Welcome everyone to Health Equity 101. Today we're going to explore key concepts, frameworks, and real-world applications that will help us better understand and promote health equity in our communities. Before we dive in, let's briefly recall what we've covered in Public Health 101, or what you might already know about health disparities, access to care, and social conditions that influence health. In the Public Health 101 training, you've learned 7 core topics that provided an introduction to the field of public health. This training is in addition to what you previously learned, and this training will introduce what health equity is, why it's important, and how it looks like in public health. Today's objectives are to define key health equity concepts, understand the social determinants of health, and learn how to identify and address health equity needs in practical situations. Let's start with a question. What in your community impacts your health? Think about your social, economic, and environmental conditions. These factors are powerful influencers of your well-being. In 1948, the World Health Organization defined health as a state of complete physical, social, and mental well-being, not merely the absence of disease or infirmity. This holistic definition is foundational to our discussion of health equity. To promote this comprehensive idea of health, we need to understand what shapes health. When asked what makes us healthy, surveys of Americans have suggested that the general public believes access to health care and individual behaviors are predominantly responsible. We know, however, that clinical care and health behaviors, while important, are only part of what drives health. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These include factors like education, income, housing, and access to healthcare. Health disparity, health inequity, and health equity are some key terms we will highlight in this training. In population health, it is common to hear differences in health outcomes discussed as disparities. A health disparity refers to differences in health outcomes across population groups, often related to race, ethnicity, gender, or geography. For example, rural communities often face higher rates of chronic diseases due to having fewer healthcare resources compared to urban areas. Health inequity refers to differences in health outcomes that are systemic, avoidable, and unjust. Health inequities are not random. They are patterned and rooted in societal structures. Therefore, because they are socially determined circumstances, they are actionable. This distinction in language helps point out and draws attention to the link between social injustices and disproportionately poor outcomes for particular communities. This pushes action not only on gaps in outcomes, but also on gaps in social circumstances that drive outcomes. Addressing health inequities requires closing the gaps in the social, economic, and environmental determinants of health. There is a higher rate of diabetes among American Indians and Alaska Natives, which reflects long-standing inequities in access to quality care and resources. This is an example of a health inequity. Health inequity is the condition where everyone has the opportunity to achieve their full health potential without barriers due to race, income, ability, or other factors. Though definitions of health equity can vary, the similarities in these definitions is to help individuals achieve their highest level of health. Examples of advancing health equity include mobile health clinics, bringing health care services to communities where transportation is limited, ensuring access to checkups, screenings, and treatments for individuals who may otherwise struggle to reach a traditional clinic. Food assistance programs addresses food insecurity caused by socioeconomic barriers. Language translation services, ensuring that healthcare providers are trained to communicate effectively with individuals who have language barriers can improve understanding and access to care. Cultural competency trainings. Educating staff about the impact of racism and discrimination on health outcomes can help them provide more equitable and culturally sensitive care. These examples remove barriers and promote access. When we are talking about everyone having a fair opportunity to be healthy, it can help at this point to distinguish between equity and equality. Equality is making sure everyone gets the same resource or access to a resource in order to address a problem. It can work if everyone starts from the same place. But if people are starting from different places, for example, if people have experienced generations of trauma or chronic stress as a result of the conditions in their community, then giving people the same thing today doesn't necessarily assure fair access to or ability to take advantage of opportunities. Equity, on the other hand, seeks to address a problem or inequity by customizing the level and types of resources provided based on needs and context. This equitable strategies might need to be unequal in order to ensure sufficiently similar opportunities for individuals and communities to achieve their full health potential. Compare these two images of people and bikes. Equality is about making sure everyone has the same bike, whereas equity is about making sure everyone has a bike that fits. Furthermore, equity includes having a person determine what kind of bike they need. This concept also translates to communities. Let's look at how receiving equality in terms of community resources might work in two communities. Notice that the community on the left doesn't have a school or hospital, and some buildings have broken windows. The community on the right receives the same amount of community resources, but also has more to begin with. For example, a school, a hospital, and trees that provide shade and beauty. Now look at these same two communities again, when there is equity in terms of community resources instead of equality. More community resources go to the community on the left to assure that community can adequately address their current context and provide better living conditions and healthy outcomes for all. Now that community also appears to be thriving. Equity means that we have good jobs with fair pay, high quality education, safe housing, good physical and social environments, and high quality health care for those who lack access and have worse health outcomes. The focus of health equity is with those groups who have been excluded, marginalized, and divested from. You will notice this doesn't impact the other community thriving conditions. In fact, this should ultimately improve everyone's well-being. This framework highlights four interconnected factors: social and institutional power, health over the lifespan, policies and systems, and community conditions. If we zoom in on health over the lifespan, we see population health outcomes. Health outcomes such as incidence of disease, injury, and death, and the disparities at a population or group level in these outcomes. Health interventions focused in this area represent a traditional medical or treatment model of population health, in which we attempt to address health through providing medication and access to medical services, education programs, and changing health-related behaviors. However, we know that these factors only comprise a portion of what influences health. The next two boxes up, community conditions and policies, programs, and systems, shift into the more upstream drivers of health. Here we find the built and natural environment, social and economic conditions, the care environment, and the policies surrounding these conditions and environments. You can see that policies, programs, and systems and community conditions are shaped by structural determinants, presented here as social and institutional power. We can define power as the capacity to act individually and collectively. Power at the social and institutional level can be understood as the capacity to distribute and access resources, the capacity to shape agendas, and the capacity to define the narrative or worldview. These social and structural determinants of health and their effects on the health of communities can span across generations. The health equity framework doesn't throw out the medical model of population health, but rather helps expand our understanding of what shapes health and the public health strategies that can address root causes of health and inequitable differences in health outcomes for different groups of people. The health equity framework presented here can also help us understand the mechanisms through which inequities manifest by differences in power, policies, programs, and systems, as well as community conditions that all influence the health of individuals. This complete framework is a tool to help us analyze health equity challenges and design more effective targeted solutions to help improve determinants caused by these imbalances. Remember, health equity are actions that address barriers to care and services that disproportionately affect certain populations, ensuring everyone has a fair opportunity to achieve their best health. Now let's look at some scenarios and identify the health equity need. A mother with two young children have missed their medical appointments. You are tasked to call the family and reschedule their missed appointment. You notice this family have missed their last 3 medical appointments. You ask the mother on the phone the reason why they missed their previous appointment. She says she cannot drive and can only get to the clinic by bus. However, she is experiencing some financial stress and cannot afford to bring her children in for their checkups. The health equity need here, but not limited to, are transportation and financial assistance. You are checking in visitors at a volunteer fair. A man approaches you and you give them the rundown of what to do and what is offered. Name tag, refreshment table, and the bathrooms. The man points to his ears and signs that he is deaf. He did not understand all the information you have just shared. What is the health equity need? The health equity need here is communication access, ensuring inclusivity for the deaf community. You receive an email with a flyer promoting proper waste management for recycling, compost, and garbage. The flyer is in English, no images, and the terminology used exceeds the 12th grade level. The equity issue here is language and literacy accessibility. Health equity ensures everyone has a fair chance to be healthy. It brings economic, social, and ethical benefits. It helps reduce disparities and supports individual and community well-being. That completes the Health Equity 101 training. Thank you for being here.